Hi everyone, myself I am Dr. Krishna. Hope you are all doing well and hope that you all have given NEET 2022 examination at your best and also excited about your results which will be out within couple of 2 weeks. But now there will be lot of students who are searching for the key in various social medias. I have prepared and collected questions and answers from most of the standard books. Let's get started. C wave in JVP is seen due to tricuspid bulging. Which of the following is true for Quincke's sign? Presence of blanching and flushing of nail bed on pressing. Not a branch from third part of maxillary artery is supraorbital branch. A 10-year-old boy was admitted to the hospital with swollen palatine tonsils, earache, high fever. The nerve carries the sensory input is glossopharyngeal nerve. Tongue muscles develop from occipital myotones. Among the following muscles, the only muscle that helps in abduction of the larynx is posterior cricoarytenoids. Which index correlates the maturational status of the tooth to its developmental stage is Darmagian index. Ratio of mesodistal width to height of crown of maxillary central is 80%. Organic lining covering the dentinal tubules is lamina limitans. Beta oxidation of odd chain of fatty acids produce propenyl CoA. Here in this question, the important key points are schistocytosis and thrombocytopenia, which is nothing but suggestive of thrombotic thrombocytopenic purpura. The best test to evaluate syphilis after treatment is VDRL, which is nothing but non-specific test, whereas for diagnosis of the case we use TPHA and FTA-ABS, which are specific tests. Preferred site for injection of the gluteus muscle is superolateral. In which of the following analysis measurement of incisors is not done? In Huckaba's analysis we use radiographs, so that is the answer. Which of the following organism is responsible for pregnancy gingivitis? Prevotella intermedia and Tannarella forsythus. Here in this question, the important key points are temperature of 103 degree Fahrenheit and lymphadenopathy and also child patient. Brucite is most commonly found in anterior mandibular region, lingual surface. Check out this sequential arrangement. This was also one of the repeat from the ortho. Raloxifene is used in the treatment of postmenopausal osteoporosis. Here in this question, the key point is monoclonal spikes that are seen in the serum and urine, which is nothing but multiple myeloma. Ovoid shaped ulcers is the key important aspect in this question, which is suggestive of typhoid fever. After the thyroidectomy, we see trachea. A young swimmer has ear infection. Viewing otoscope, the patient coughs. Nerve, in this case, the nerve irritated is vagus nerve. Tripoding is seen in which of the following grasps? Modified pen grasp. Osteomalacia is characterized by normal osteoid plus defective mineralization. Intranuclear lesion of the facial nerve causes ipsilateral half of the face to be paralyzed. Which of the following is precancerous lesion has malignant potential is erythroplakia. Lifesaver shaped appearance or McCall festoons. Apostrophe shaped appearance or Stillman clefts. In Viennese classification, type 2 is 2 orifices, 2 canals and 1 foramina. According to Tsuchihase classification, branched pattern is type 2. I have kept this pic directly from the synopsis of Dental Pulse. Identify the type of cartilage shown in the diagram. Hyaline cartilage. The main key point is here it is extrinsic strain which is caused by the chromogenic bacteria. Which of the following is anti-apoptotic gene? Buccal2, BCL2, MCL and BCLXL. Propranolol is widely used in thyroid storm, decreases the sympathetic activity of thyroid gland by decreased conversion of iodine to tyrosine. Dentigerous cyst arises mainly from unerupted tooth. Identify the structure. Here all the three options are not relevant. It is mesiodense or supernumerary tooth. Mesial marginal groove is present in which of the following tooth is maxillary first premolar. Here the patient gives a history of trauma and also long duration, so it is nothing but internal resorption of the tooth. Mesiolingual developmental groove is seen in mandibular first premolar. Here the patient is on rifampicin, which is nothing but enzyme inducer and induces the metabolism of oral contraceptives, so she becomes the pregnant. Impression material of choice of flabby tissue is irreversible hydrocolloid, which is an example of mucostatic impression technique. Another example is impression plaster. Here multiple loci are seen in the radiograph, which is suggestive of nevoid basal cell syndrome, NBCCs. Implant analog is mainly used for replication of implant in the cast. Green strength is also known as wet strength. Here the case is clearly suggestive of botryoid odontogenic cyst. I have taken this from standard book. Less excess water is present in which of the following according to ADA specification number 25 is dental stone with high strength. Lap sliding fit, this was repeat for so many times. 30 degrees 0.05 to 0.02 mm. IOTN, I have posted all the 10 grades of IOTN. In the examination they have given grade 10. Thank you guys. Hope you loved the session. I will be back soon with another 50 MCQs shortly.